Buckle up for this episode, because today we're lifting the veil off of a drug that's being called gas station heroin. Yes, you heard that right. It's called Tianeptine, and it's popping up everywhere with the promise of boosting brain function. But let's just say, there's a dark side that's not being advertised. I am Dr. Harold Pierre. I am a board-certified addiction medicine specialist and anesthesiologist. I have 25 years of experience treating addiction in the operating room, methadone clinic, and Suboxone clinic. This is an informative podcast and is not meant to replace consulting a doctor to evaluate your condition. Use this for information only. It's definitely raising red flags, even in the medical community. Although it's marketed as a harmless supplement, Tianeptine has a history that tells a completely different story. Originally developed in the late 1980s as a treatment for depression, Tianeptine was approved in several countries as an antidepressant. But here's something interesting. It never got the green light as a prescription antidepressant in the US. Even though it hasn't been approved here, that hasn't stopped it from flooding the market. It's everywhere, online, and even in gas stations, often disguised as a nootropic, a supplement claiming to boost cognitive functions like memory and focus. However, here's where things start to get shady. Tianeptine is being sold under flashy names like Zaza, Tiana, Red, and even the pretty scary nickname gas station heroin. What makes it so different and potentially dangerous compared to other antidepressants? The nickname gas station heroin is a big red flag for a reason. Many people, even healthcare providers, mistakenly lump Tianeptine in with SSRIs like Prozac and Zoloft, household names when it comes to antidepressants. But Tianeptine isn't an SSRI at all. It works in a totally different way, and this is where the gas station heroin comparison becomes relevant. Tianeptine works as an opioid receptor agonist, which means it acts on the same brain pathways as powerful opioids like heroin. That's where the nickname comes from. What's really alarming is that people are completely unaware of Tianeptine's opioid-like effects. The receptors it targets are involved in pain relief and the euphoric feelings that come with opioids, like that initial rush of well-being that users often describe. However, here's the kicker. Tolerance builds incredibly quickly. In this context, tolerance means that someone taking Tianeptine will need more and more of the drug to feel the same effects over time. You might start with a small dose, but very soon you'll need to double it just to chase that initial feeling. That's how fast tolerance can develop. This fast buildup of tolerance is a major red flag. The consequences of this, often referred to as Tianeptine toxicity, can be life-threatening. At high doses, it essentially mimics an opioid overdose. We're talking about nausea, vomiting, intense sweating, and a racing heart. In severe cases, Tianeptine can lead to respiratory depression, where your breathing slows down so much it may even stop altogether, which can be fatal. And we haven't even touched on the withdrawal. Accounts from people trying to get off Tianeptine describe the withdrawal as brutal. Chills, muscle aches, and extreme anxiety, much like heroin withdrawal. This is because Tianeptine messes with opioid pathways, leading to physiological dependence, where the body becomes reliant on the drug just to function normally. When someone tries to quit, their system goes haywire, which is why some people need medications like buprenorphine to manage the withdrawal. Buprenorphine, often used to treat opioid addiction, acts as a milder substitute for more powerful opioids, helping to reduce cravings and ease withdrawal symptoms. But here's an important note. No one should try to manage Tianeptine dependence on their own. This is something that requires medical supervision. Self-treating can be incredibly risky and may even backfire in the long run. If you or someone you know is struggling with Tianeptine dependence, reach out to a doctor or a treatment center for proper help. It's scary to think that people might be using this, thinking it's just a supplement, when it's actually a lot more dangerous. That misleading marketing is a huge problem. People see it online or at gas stations next to vitamins and energy drinks, and they assume it's safe. The reality is, Tianeptine is far from harmless. And even worse, sometimes it's mixed with other substances, which throws an extra wrench into the situation. Mixing Tianeptine with other drugs can create a nightmare scenario for healthcare providers trying to treat an overdose. The combined effects of different substances can be unpredictable, making it nearly impossible to treat effectively. Unfortunately, there's not a lot of information out there about Tianeptine, especially when it comes to how it interacts with other drugs. This makes it even harder for healthcare professionals to treat cases of Tianeptine misuse or overdose. So, where do we go from here? Awareness is key, both for healthcare providers and the general public. Doctors need better testing methods to identify Tianeptine use, especially when it's mixed with other substances. And for those struggling with Tianeptine dependence, it's crucial to break down the stigma around addiction so people feel safe asking for help. Ultimately, we need to educate the public, educate healthcare professionals, and expand access to treatment and support services. It's a big challenge, but we have to start somewhere. That's all the time we have for today's deep dive. We've covered a lot of ground, from deceptive marketing to the very real dangers of Tianeptine toxicity, withdrawal, and polysubstance use. This so-called gas station heroin is a growing problem, and it's a stark reminder that not everything marketed as a harmless quick fix is what it seems. Do your research, ask questions, and if you or someone you know is struggling with Tianeptine use, please reach out for help. There are resources available and recovery is possible. Don't wait until it's too late. Stay informed, stay safe, and thanks for taking the time to listen.